Welcome to my study. I am Sam the Man, an independent Medicare health broker handling all plans. I am in Austin, Texas. I am licensed in the state of Texas. We've talked about Medicare. Now we're going to go into a little bit more detail on Medicare Advantage. So we start, as before, with our original Medicare. Okay? A for hospital, B for medical. That's all it covers. An advantage is when you take your original Medicare and move it over here to a Medicare Advantage. Now Medicare is paying the insurance company. The insurance company is contracting their doctors and giving you their copays and benefits. Many people enjoy the Advantage because it is cheaper. Most of these Advantage plans, you pay nothing by the month. If it's your primary doctor, you pay nothing. Zero copay. So that's not costing you anything if you're just going to your regular doctor. Now, if you're going to some of the other people, like under B, that might be a specialist doctor, could be $30, $40, $50 copay. Depends upon any of the 38 flavors we have in our area here in Austin. Your hospital would have a daily copay up to maybe 5 or 6 days. Labs and x-rays, everything Medicare says is approved, the Advantage will cover. However, if Medicare doesn't approve of it, like shingles vaccines, the insurance company's not going to pay for it. One other thing that's important about Advantage is it has a stop loss, what they call an out-of-pocket maximum. Okay, so for instance, on original Medicare, there's no limit. You keep paying 20% until you go broke. With an Advantage, the law says they have to have an out-of-pocket maximum, a stop loss, of $6,700 or less. So that means if you added up all your copays and everything you're paying in a bad year, it stops at $6,700. Some of the insurance companies are a little bit lower. Your Advantage will also include your drugs. So unlike a Part D where you're paying by the month, you're not paying anything here. Okay? Then what people really like with the Advantage is the added benefits. Dental is very, very important. Most people don't realize how dental can impact your health. You can actually get diabetes, heart problems, from bad teeth. Not to mention, if you don't have dentures, how are you going to eat? So there's a variety of different benefits on all the different plans. It might include some dental, money for eyeglasses, rides to the doctor, the workout privilege where you can go to the name brand exercise places and get in no charge. Some of them have acupuncture. Some of them have chiropractic. It all depends on that plan. So which one's right for you? Well, there ain't no one right one, because first of all, an Advantage plan, because the insurance company's managing it, you're going to go to their doctors. They're going to have their own group, and your doctor, if he's in it, well, that's great. But if he's not, and you go see him, you will pay the whole bill, because Medicare is already paying the money to the insurance company. Okay? So there's a limitation in terms of what they call a network or a book of doctors. Additionally, the geography can be limited. Okay, so in an HMO, you're going to have to live in this area, and you will go to the doctors in this area that are in their book. If you go to someone who's not in there, you pay the whole bill. Outside of that area, you have no coverage except for emergency coverage only, and that's anywhere in the world. Now, an HMO, they're paying the doctor every month to handle the needs. A PPO is a little different. A PPO gives you a wider latitude. You don't have to get a referral to a specialist like in an HMO. A PPO, you can go to a different one. PPOs have a wider geography. Generally, you can travel with them across the country. You just have to find a doctor who takes it. Okay, two types. The first is the contracted doctors in the network. They agree to accept the regular copays, maybe $0 for a primary, so much for a specialist, etc. It's an advantage. There are also out-of-network doctors. They'll take your plan even though they're not contracted with the insurance company, but it's going to be for a higher price. You might pay half the bill. Additionally, there are certain situations, like you go down to MD Anderson, they are an out-of-network provider or doctor. However, they'll take you for in-network pricing. That's rare, but some people, I mean, that's really decent for them to do that. So your PPO, you're going to have a wide amount of travel, your copays will be a little bit higher, and you will get all of the extras, maybe not quite as much as an HMO. That's a PPO. Now, let's put another wrinkle in it, okay? Because those plans we talked about had drugs. Well, there's another HMO or PPO that doesn't have drugs. You're getting your hospital, medical, and the extras. And the copays are a lot less. Now, for my boys in the VA, they normally get their drugs there. So with this plan, it would just be for hospital and medical, okay? One word of caution. You cannot get a Part D drug plan and put it with that PPO or with that HMO, because if you got it, it would kick out the health plan. So you can't put anything with it. The only plan that you can put one with it is called a PFFS. You can have it with or without drugs. If you take it without drugs, you can also go buy a Part D. Well, it's a very exotic creature, this PFFS. Basically, you go to a doctor, and if he's willing to accept the terms and conditions and get paid for that insurance company, he'll take it. He doesn't have to. He might change his mind. But in certain situations where you've got doctors all over in these blue moon places, a PFFS could be a good call. So those are the main types of advantage. What does it determine? Which one's going to be the right one? Well, what's your budget? The HMO is cheaper. Okay. Is your doctor in the network? Well, then that's great. You don't have to change your doctor. Okay. And it is like putting a puzzle together. We've got 38 plans that I handle. A PPO, man, you got to have one if you're going to travel, because if you go down to Florida and you get sunburned bag, you got medical coverage. You just need to get one that's going to take the contracted amount. And the bigger health insurance companies, they've got contracted doctors all over the country. Every year, the new policy starts January 1st. So there will be some difference, not only in the price or no price or benefits, but also whether the doctor's taking it. So every year you want to go around and make sure your doctor's still going to be taking that plan. Most do, but I've seen it change and people get hit in a bind because all of a sudden the doctor stops taking it. You can't go to that doctor, okay? So Medicare Advantage, it's not like a supplement. A supplement you can buy or sell or get it or not get it whenever you want. With an Advantage, you have limited times of year, and you have to have enrollments to be able to get in. Now, everybody, when they first get Medicare, they're entitled to enroll right then and there. And there's like 3 months before, 3 months after. I don't want to complicate it. After that, there is annual enrollment, AEP, lots of acronyms here. That is that time from October 15th through December 7th. You can pick as many different plans as you want, and the ones that left standing on December 7th, that's what you get on January 1st. The next is your open enrollment. Okay, let's say you don't like that plan that started January 1st. Well, you have up until the end of March to make a one-time switch. Okay, then, and there's a lot of these, what if you get extra help on your drug pricing, or if you got Medicare savings or state assistance? Well, you get to make a switch once in the first quarter, second, or third. Maybe you moved here. Well, you've got a couple months to go ahead and pick up a new plan. A month before, 2 months after. Okay. Maybe you have a disease like diabetes or congestive heart failure, they have Advantage plans that are called chronic care plans. Okay, and you can get in that plan. You get a one-time choice that year. There are other what they call special election periods. You're not necessarily locked in. This is kind of like accounting or law. You need to talk to somebody who knows all of this. So that's what I do for a living. I'm an independent Medicare health broker. I do not work for an insurance company, but I contract with all of them to help my clients. Here's a little bit about me. I work by phone only. I have a handicap in my arm. I cannot type at all. My phone number is 512-971-7011. Give me a call. I'll get back to you within a few hours. Lastly, I always like to think of people who helped me so much. The first one, of course, is the man shooting this movie camera, Mr. Chainsaw Leon, a master of movies here in Austin, Texas. Second would be my sister. There she is performing. She's quite the performance artist, all the acrobatic yogas and dance and singing. She's amazing. Randy Southern. My daughter, Sedona, who is an excellent real estate saleswoman. She's already moving up in her office. And then lastly, my grandson, William, who always reminds me how important it is to play. So whenever I pick up a water bottle, he runs because I will be letting it loose on him. That's it. I am Sam the Man. God bless.